Imagine you bend down to tie your shoes, or you bend down to pick your child who has come running after you and wants to give you a hug. Or you simply stand up from your chair after working on your desk all the day long. Then suddenly you realize you have this sharp pain that shoots through your lower back. Most of the people will blame their age. They will think I slept the wrong way. I've had this so many times with my patients. I lifted something too heavy, or possibly I have a slipped disc. But what if I told you that the real problem may have started months or even years before that pain appeared? Not because your spine has become weak, but just because some of the muscles in your back that are supposed to protect it slowly have stopped doing their job. And this is related to our lifestyle. So, research has shown that most people with chronic low back pain, it's often due to atrophy and fat infiltration of one of the most important muscles in the human body. And that muscle is called the moat bifidus muscle. It is the muscle that stabilizes your back and your vertebral bodies. So that means the healthy muscle has literally been replaced with fat. And the scary part of it is that you don't have to be injured, you don't have to be old, you simply have to sit and sit and sit and sit. And this is unfortunately what has happened in most of our lifestyle. Myself as a doctor, possibly working to see my patients, if I don't intentionally move, then I can spend my whole day sitting, possibly only waking up to examine a patient. And if you're not careful, you may just be relying on listening to the patients, and then after the story, you send them to the labs. But if you intentionally make it to move, then you can make a difference in your life. So in this video, I'm going to share with you some hidden anatomy behind your back pain so that you understand it, and then not only understand it, but understand why prolonged sitting is quietly damaging your spine, and the simple evidence that exercises can actually rebuild your stability and help you stabilize your back for the years to come. And low back pain or neck back pain, because that is where we have most of our pains, does not have to be your story. I'm Dr. Nderitu. I am a family physician. I have interest in public health and cancer prevention and treatment. In this channel, the overall health, we break uh, we break complicated science into simple steps that you can use on a daily basis, because the difference comes not in knowing, but in putting it into action. So let's begin. So why am I concerned, and why even yourself should you be concerned of back pain? Back pain is one of the leading causes of the disability worldwide. And nearly everyone, including myself, at some point, you may not experience it to a level that it destabilizes you. But once in a while, you have some back pain of some sort. And the unfortunate thing is that millions of people spend a lot of time, a lot of their working time, trying to sort out back-related issues. You'll find that people will spend time on painkillers and their money. They will spend money on massage. They will spend money on corsets. They will spend money on chairs. They will spend time on braces. And even some people go to the extent of having surgery. I'm not saying that these are not important, but if you're not well informed, you may not have actually addressed the real problem. So imagine your spine as a mast of a sailing ship. You know what that is blown by the wind. And the mast is not held upright by the wood alone. It depends on dozens of tightly coordinated ropes pulling in a perfect balance for the mast to stabilize the ship and keep it on course. So if you cut several of the ropes that stabilize that mast, then the mast becomes unstable. It might not fly as high as it is expected, and then you find that the ship is wobbling because there is no stability. So the wood is not the main problem, but the ropes have been cut off. And so the missing support that supports the mast has been cut off. And that is what happens to your spine when it is not well supported. And that's how your spine works. So let's look at the three pillars that hold your spine in a stable position. To understand the back, we first need to understand that one of the most models in the spinal medicine, and this was developed by a Canadian biomechanical researcher called Professor Stuart McGill, and they had also some work done on the spinal cord by another professor called Mahal Pajab. They showed that the spinal cord stability depends on three interconnected systems. So this is not a hard anatomy that I'm going to teach you, but it's something that helps you understand why your spinal stability is becoming compromised and why you have that back pain. So this is like a three-legged stool. If you remove one of the legs, then the stool becomes unstable. So there is the passive system of what supports your spinal cord. And this will be included by your vertebral bones. The vertebral bones, they run from the neck all the way down to the lower part of your back. We have five spinal vertebrae. We have 12 thoracic spinal vertebrae. We have 5 lumbar, and we have the lower part, which we call the coccyx, which has 4 bones. Then we have the discs. The vertebrae are bones. Then what connects the bone to each other is the discs. The vertebrae are bones. The disc, they are soft tissue and they can be able to move. Then we have the ligaments. Ligaments are what joins muscles and the bones together. And then we have the facet joints, the outpushing of the vertebrae. So this structure provides the shape of your spinal cord, and they limit the excessive movement. So they protect the spinal cord. The spinal cord is the central part that contains the nerves, which run from the lower part of your head, the lower part of your brain, or down to the lower part of the vertebral column. And here is something that most people don't know. The spine on its own is surprisingly very weak. Laboratory studies have shown that when the muscles are removed from the cadaver spines, the buckle are the relatively small loads. So on their own, the bones cannot be able to hold themselves together. They cannot be stable. So they are wobbling. But now the muscles come in and they stabilize the spinal cord. And so this is the system number 2 of stabilizing your spinal cord. So this is the active system, and this is where the real supporters are. We have the muscles. Of course, muscles add up into tendons that join them into the bone. And then we have the muscles are in different layers. We have the front abdominal, so the muscles of the back, and then we have the muscles that are lined on the anterior and the posterior part of the spine of the vertebral column. And this includes that muscle I've told you called the motive bifidus. Then we have the transversus abdominis, the anterior abdominal wall muscle. We have the diaphragm. The diaphragm is the muscle that separates the chest part and the abdomen, and it has a role in stabilizing the spinal cord. Then we have the pelvic floor, which is made of the pelvic bones and their accompanying muscles. We have the gluteal muscles and the muscles inside the pelvis. So these muscles, they create something that is very important because they are the ones that give your spinal cord and your vertebral column stability. So you think of them like guy wires that support the radio tower in that mast example we had given. And they do not create dramatic movement. They quietly avoid unwanted movement so that your spinal cord is in a stable state uh, every second, every step, every time you bathe, and every time you cough, every time you lift your groceries, every time you pick up your child, they are constantly making tiny adjustments so that they maintain the alignment of the vertebral bodies and the disc. And this happens 1,000 times every minute, and you do not even notice it until when they don't when they stop working, then you start knowing that you are feeling some instabilities. Then you have the number 3 system, the third pillar of the stability of your spinal cord. And this is what we call the neural control. Neural, when you hear anything, neural, it involves the nerves. These are the communicating wires that move from your brain to your spinal cord and to the different muscles in your body. So imagine having the world's strongest muscles, but they activate 1 second too late. There's no coordination. You are still in trouble. So the muscles don't just need the strength, they also need the timing and the commands. And the brain continuously is receiving information from your muscles, from your joints, and the ligament. And this, then it is able to decide which muscles to contract, how hard, how long, and this is what keeps you going, and even the sequence of the movement. So this incredibly sophisticated system keeps every vertebral body moving just enough, but not so much such that you have instability. And this is what the scientists call the neutral zone that controls your muscles and your nerves and the spinal cord. And this concept has incredibly been very important in controlling and maintaining. We have what science call the neutral zone. And this concept is incredibly important. So what is this neutral zone? Think of the shopping trolley or the trolley that you use to carry things. If one wheel of it is loose, then the trolley starts to wobble. It can still move, but it's very unstable. And each spinal segment behaves similarly. Every vertebra has a safe range of movement. And it is not still, it is not too loose because that area called the neutral zone is what maintains this imbalance. When the stabilizing muscles become weak, then the neutral zone becomes larger. So more movement happens and your joints begin moving excessively. If they move excessively, then they can be destabilized and you get the disc can move out of their balance in some way. And so the ligaments, the facet joints, day after day, month after month, if they become destabilized, then they eventually become unstable. Your disc can become displaced and then you have pain. Not because the pain came fast, but because the instability came fast. And the instability is being caused by these muscles becoming weak. And this is quietly being contributed by our lifestyle. So remember those 3 pillars. We have the vertebrae, we have the disc, we have the muscles, the ligaments, and the nerves. And now they maintain a balance in what we call the neutral zone that maintains everything in range. So let's look at sitting and how it quietly disturbs this system. Now, this is where modern life has destabilized our back. Most of all of us who are working, we will spend 8, 10, sometimes even 12 hours just sitting. Not because we are doing nothing, but because your work is designed that most of it you are doing it sitting. You could be a driver, so most of the times you are sitting driving. You could be working, like myself as a doctor, sitting on my table, seeing my patients, or even doing these videos. Sometimes when I'm making them, editing them, I need to sit for long hours. I could be studying, or even watching television, just having a good time, or scrolling through social media. This one makes sit for long, and we don't even move because you move from video to video. So the human body was not designed for this. The design of our spinal cord was for movement. And this prolonged sitting creates a chain of reaction. So the first thing is when we sit, we have the muscles that we call the hip flexors. They keep your feet at 90 degrees. So your feet remain bent all day. What happens? Is a muscle we call the iliopsoas muscle, and this is the main flexor of your hips. So this muscle stays shortened for a long time, hour after hour, day after day, and eventually it adopts to that because that is what you have trained it. And so when you finally start, those tight flexor muscles pull on your pelvis and the pelvis rotates forward. And this increases the stress throughout your rubber spine because you have sat for too long. The muscle has become weaker. It is not, it is adapting to the new way of life. And unfortunately, it affects the whole system. So then we have your gluteus muscle, the muscle that you sit on. And it is the one of the biggest muscles in your body, the muscles that you need to move, even for you to be able to metabolize. And in my previous videos, I've talked about the importance of the thigh muscles, the gluteal muscles, when it comes to the absorption and the usage of glucose. So your gluteal muscles, they are among the strongest muscles in your body, and they are designed for walking, they are designed for movement, running, climbing, and studying, jumping. But then when you sit on them for too long, you switch them off. And the physiotherapy sometimes call this gluteal inhibition or gluteal amnesia. Amnesia means just forgetting. So the muscles have not disappeared. They are still there. They might become smaller because of disuse. Remember, use of muscles makes them larger and it makes them more effective. So your nervous system stops recruiting more of them more efficiently. And now when you lift something, then instead of those strong hip muscles generating a force, your lower back tries to compensate for the weak glutes. And this will happen if you imagine like your body, you are towing a truck and then you are using bicycle brakes. They are not enough. So something you definitely fail. So that's what happens. Your glutes are not strong enough. They are trying to get more support from your back, and then your back is not well uh, suited for this kind of work because that is not what the spine was meant for. So then the step 3, we have this now, the motivators, the muscle. And this muscle, when you sit for too long, it begins to shut down. And this is where things become truly fascinating. The motivators muscle sits deep beside each vertebra. It is the one that holds the vertebra together. And unlike the large muscles, it doesn't produce massive movement. The multifidus muscles does not move a lot. It stabilizes the individual spinal segments. I've said the spinal cord is the vertebra and the discs and the nerves and the muscles. So think of it as the precision engineer, the multifidus muscle of your spine. You are sitting in a supported chair, like the way I'm sitting, and this muscle barely has work. So if I sit for too long, if I was standing or I was moving and I was not supporting my back, then my muscles would be the one that is maintaining my spinal straight. Okay? But when I sit for too long, the chair is doing the work. So these muscles are not doing much. And I do this not just for 1 hour. I do this for days. I do this for months, and then months to years. Then the nervous system will follow one rule, and we know it: use it or lose it. So research has been done using MRI scans, and it has repeatedly shown that people with chronic lower back pain often have smaller multifidus muscles. There's loss of muscle volume, and the fat is replacing the healthy muscle tissue. And this phenomenon is called the fatty infiltration of your muscles. And when most of the time that people have MRIs that what they report is that you have mild muscle spasms. Okay, so muscles, because the muscles have been unable to support you, they are weaker, so they will show like muscle spasm uh, because of fat infiltration. And third, this tend to be most obvious allowed L4, L5, and even L5 and S1. These are the segments of the spinal cord. So these are the exact levels where we have the low back pain. And this is not just cosmetic. It is fat that cannot be able to stabilize your spine because it does not have the capacity. And the heavy muscle that is supposed to do this is gone from sitting too much. So when that pain starts developing in your neck or in your lower back, then think of your sitting or your work. What have you been doing? You may think, yes, I lifted something heavy, I did this. Yes, this can cause instabilities, but this starts long before you have the instability. Then there is the fourth system that happens. We have the transversus abdominis, the muscles of your abdomen that also have some role in protecting you. And this muscle also deserves attention. Why does it uh, deserve some attention? If your abdomen like a soda can, then the muscle would be the can itself. So because it wraps around your abdomen, and when it contracts, it gently increases the abdominal pressure, and that pressure stabilizes the entire spine. So it's like inflating a car tire. If it doesn't have air, then it cannot be able to move the vehicle. And without adequate pressure, then the tire definitely collapses. Without adequate core activation, the spine loses its support. And this muscle, it normally activates in milliseconds before your arms and your legs move. You may not realize it, but that's what happens. So that is how quickly your brain protects your back. But studies have shown that activation becomes delayed in many people with persistent back pain. And the protection, when it arrives too late, and then this is what makes your back to wobble, and it is unable to carry you adequately as it should. So let's look at all this together now. So imagine you have a perfect storm. The hip flexors are tight, your gluteus are asleep, and the multifidus muscle has weakened. Your deep abdominal muscle also activates too slowly. Your discs, your ligaments, and even your facet joints absorb forces that they were never designed to handle alone. Pain is not just a random happening. It is a consequence of support system that has gradually broken down with time. And this is the encouraging news. This process of loss of your lower back support and your back support system, because the whole back, the whole of your spinal cord can be retrained. As I have said before in my previous discussion about muscle power, muscles can always be retained, and it doesn't matter at what age when you start it. So your nervous system can learn with proper activation. That is the good news. And your spinal cord, which has become unstable, can always be stabilized again. So, in the next, as we continue this discussion now, we will discuss how some world leading experts rebuild this system using three highly targeted exercises known as the McGill Big Three, along with simple daily habits that can dramatically reduce the stress on your back while improving your strength, resilience, and even long-term functioning. So now we are going to look at the evidence-based methods of rebuilding a strong and stable spine. So we have looked at the anatomy of the back. So we have uncovered something that you never hear many times, that your back pain is not necessarily because your spine is wearing away. It is because the support system is wearing down. We have the deep stabilizers that have stopped working. We have the discs, we have the ligaments, we have the joints that are becoming the body's backup plan. And this was not the design from the beginning. So now let's look at the exciting part of this discussion. Unlike worn out brakes on a car, muscles are able to rebuild. The nervous system can relearn, and your spinal cord can become more resilient with more training. And this will happen if you retrain your spinal cord. So, how do people make their back pain worse? When people develop back pain, they respond in one of the two ways. First, some people do nothing. Because of the pain, they rest. Unfortunately, when you rest, you make the problem worse. Others will avoid, so they avoid movement. They become afraid to bed. They become afraid to rest. They become afraid of exercise. And ironically, this prolonged inactivity, unfortunately, uh, destabilizes the spinal cord even further. I always say that diseases sustain themselves. It's like they isolate you, they make you weak, and they make you not move. When you don't move, the problem gets out of control, and so it becomes difficult. So even if you have pain, try simple things, and I'm going to show you and share with you some of these exercises, what we call the big three, have been shown to do to help stabilize your back. So the second group goes to the gym. They start doing headrest sit-ups, crunches, or heavy twisting exercises because they have been told they need to build their core. Now the problem is a strong core is not the same as a stable core. You may have a strong core but not a stable one. So imagine building a skyscraper, but before you make the walls stronger, you first of all need to have a basic stable foundation. So your foundation must be stable. If the foundation shifts, adding more concrete or even more metals on the concrete does not solve the problem. It is simply places more stress on their stable structure. So that is exactly what happens when people repeatedly flex and twist the rubber spine under load. So there's a professor who is known as Professor Stuart McGill, and he demonstrated in his laboratory that repeated spinal flexion, other compression, it significantly increases the stress on the intervertebral disc. So where do you start? So your goal is not just to strengthen the muscles, it is to teach them to stabilize the spine while keeping it safe in its neutral position. And that is where the three McGill 3 exercises come in. So we are going now to look at these three McGill Big Three exercises that can change everything about your back pain. So this, we are not just talking about bodybuilding exercises. We are talking about rehabilitation exercises. Their purpose is simple. They create spinal stiffness without excessive spinal movement. Remember what we learned earlier. Your spine needs controlled stability, not endless motion. And we are going to go through these McGill's 3 exercises. So there's what we call the McGill's modified curl up. This is not a sit-up. In fact, if you have been doing hundreds of sit-ups, hoping to fix your back, it is time to stop. And here is how you perform this modified McGill's curl up. So the first thing is you need to lie on your back, okay? Then you bend one of your knees, okay? Then the other leg is straight. So you have your leg, one of your leg is straight, the other one you bend it, then you place your hands under the neutral curve of your lower back. So you are lying flat on a flat surface. You have straightened one leg, you have flexed the other one, and you have placed your hands in the opening of your spine around the lower back. This helps you to maintain the natural curve of your spinal cord in its natural neutral position. Now, you gently brace your abdominal muscles. So you move your abdominal mass. So you lift the head. So you try to lift the head a bit and your shoulders a few centimeters from the floor. Then you hold for several seconds. You don't flatten your back. You don't pull your neck. So you hold for about 10 seconds. So you're lying flat. You have your hands on the lower part of your back. Now you're trying to lift the chest and the head a little bit. And you hold for about uh, 10 seconds. And you repeat this several times. When you do this, you notice something is happening. So your abdominal muscles are working and your lumbar spine is not repeatedly bending. That is exactly what we want. We want to create a stable back. So we are building endurance and stiffness while protecting the disc. Quality matters much more than the height. So think of precision, not the effort. So that is called the McGill #1 exercise or the modified curl workout. Exercise number 2, the side plank. The side plank is an exercise that we know. Your spine does not only move forward and backwards, it also needs protection from sideways forces. So this is where the side plank comes in. You lie on your side, you support yourself on the elbow. So you are lying on the side and you're supporting yourself with the elbow and you lift yourself up. So you are training the lateral stabilizers of your spine, not the oblique, the obliques. So you are this the muscle we call the quadratus labulatum and your gluteus medius. So these muscles they prevent the pelvis from collapsing every time you walk. So you think of yourself walking on the stairs, carrying your groceries in one hand and lifting your child. So every one of these activities challenges your spine from the side. So the side plank teaches your body to resist those forces safely. So in the side plank, you rest on your hand and you are lying straight. You lift yourself up, you go down. You lift yourself up, you go down. You lift yourself and you practice this several times. You can do up to 10 times. And you do both sides. You do the right and the left plank, side plank. Then you have the exercise number 3, which they call the bird dog. This exercise looked very deceptively easy. It is actually one of the easiest ways to retain the coordination between your brain and your spinal stabilizers. You begin with your hands and knees. So you bend down and then you hold yourself on the floor with your knees and your hands. Then you brace your core gently. You extend one arm. When you are kneeling with your hands and knees, you extend one arm and you extend one leg. Nothing else moves. You have your hand with a fist held on the front like that. One of your legs is lifted up, not so much, just level, and then nothing else moves. So your hips stay level and your lower back stays neutral. So imagine like you're balancing a glass of water on your lower back. So don't spill it. So you hold, you return. So you switch sides. So you do this side. When you're doing the right hand, then you do the left leg is the one that is lifted up. Then you change hands. You do this hand and the left leg. So the goal is not the height, but it is to control. You are holding your hand in the fist position. Your leg is extended up, and this teaches the multibifidus muscle and the surrounding muscles to stabilize individual spinal segments during the limb movement. And that is what these muscles were created to do on a daily basis. So this is what you need to do to stabilize your spinal cord. And you do this. I teach my patients how to do this, and they find even the pain from the time they begin doing it eases because you are trying to stabilize your spinal cord. The secret that makes these exercises work. So most people think that more is better, but not here. So your stabilizing muscles are endurance muscles. They are designed to work all day with low intensity. Instead of exhausting them with 100 repetitions, focus on the perfect technique of doing this. Professor McGill often recommends short holds with multiple repetitions rather than one long one because that will be fatiguing and it will overwhelm your muscles. Think about your brushing teeth. You don't do it once for 30 minutes. You do it every day and consistently will beat the intensity. So let's look at the other half of the equation that the sitting broke. So exercises alone are not enough. Remember, we are talking about a chain reaction caused by sitting. So we need to reverse every link. So let's look, we have said that your hip flexors have become shortened. So your hip flexors have spent hours in shortened position. So stretch them daily. Use half kneeling hip flexor stretch. You kneel, then you move your hip towards the front and you keep this many times and you keep your torso upright and then you squeeze your gluteus as the kneeling leg is holding you on the ground. So you should feel the stretch in front of the hip, not on the lower back. And the mobility restores normal pelvic mechanics. Then you also need to wake up your gluteal muscles. So your glutes are your body's engine. So simple gluteal bridges, just like lying down and lifting yourself up with the hands on the ground, or doing mini bird walks or bodyweight squats. This one will help you build your gluteal muscles. These exercises remind your nervous system to use the hips instead of overloading the rubber spine. And then every strong lift begins with strong hips. That's what you have to remember. So breaking up the sitting. So here is one of the simplest interventions with the biggest payoffs. So don't sit continuously for hours. Stand, walk, stretch, move, even 2 minutes every 30 to 45 minutes can reduce the stiffness and encourage muscle activation. So after you have sat for so long, you are doing something sitting. You don't need to do big things. Just doing that. Sitting, standing, sitting, standing. It might be what will make a difference in your day. And it is what is going to make your back work for you. So your body drives on movement variability. It doesn't care whether you have the world's most expensive ergonomic chair if you never leave it. A good seat will not sort out your consistent sitting. Movement is your medicine. Now, how do we build a back that lasts? I tell this to many of my patients. Don't chase pain relief. Chase resilience. Pain relief is temporary, and I like saying that medicine will help you. But if you want true healing, it comes from your habits. Resilience changes how your spinal functions on a daily basis. Ask yourself, can I maintain good movement even when I'm tired? Can my core stabilize when I carry my shopping bags? Can my hips generate power instead of my lower back? Can I sit for work without forgetting to move? The strongest back are not the ones that never bend. They are the ones supported by muscles that activate automatically every single time. And that's what this discussion is all about. Rebuilding a stable back. So, what have we been discussing? Back pain is rarely caused by the one bad movement. It is usually a result of thousands of hours of poor movement habits. Prolonged sitting tightens your hip flexors. It weakens your gluteal muscles and it deconditions the motor bifidus muscle, the main stabilizing muscle of your vertebral column, and it delays the activation of the transversus abdominis, that muscle that covers your abdominal region. So gradually, your passive structures, your discs, your ligaments, and your facet joints are forced to absorb loads they were never designed to carry because the other system has failed. It is like children where the parents are not there. They take up roles that were not meant for them. And definitely they will suffer the consequences. The solution is not headrest stretching. It isn't headrest clashes. It isn't bed rest. It is rebuilding the active stability system of your spine. Train the right muscles, maintain your neutral spine, and move frequently throughout the day. Build endurance instead of chasing exhaustion. Small, consistent action performed persistently daily will always outperform heroic occasional workouts. So, if you have been struggling with your lower back or even your neck pains, remember this. Your spine is not fragile and it is adaptable. The human body is remarkably capable of recovery when it is given the right stimulus. So, start with the McGill's Big Three exercises. I have shown you what they are. We have the modified curls lift, we have the side planks, and we have the bad bull exercises. And these ones, they break up the long periods of sitting and they strengthen your back muscles. So break up those long sitting sessions. Strengthen your hips by doing exercises to strengthen your thighs and your hips. So make sure you are moving every day. So your future self will thank you or just because your back will hurt, not just because your back will hurt less, but because you move with greater confidence, more strength, more freedom to do the things that you enjoy. And the most important thing, if you have children, you enjoy time with them. If you have grandchildren, you'll be able to move around with them, play with them, carry your shopping from the market without needing assistance. If you find this video helpful, share it with someone. And also, subscribe to the Overall Health YouTube channel so that other people can be able to notice this content and be able to benefit. So let's all exercise together. Let's all learn together. If you want more evidence-based videos that simplify medical science into simple steps that you can use on a daily basis, I encourage you to subscribe to the Overall Health YouTube channel. And also remember that health is not built on perfect workouts. It is built on small choices that you repeat every single day. And if you want guidance on how to practice and do these exercises and be able to develop habits that will sustain your health long term, join our coaching program, the Health Insight 360 program. There we take you by the hand. We help you adopt habits that keep you healthy. You'll be able to reverse diabetes, hypertension, control, and overcome obesity. with simple lifestyle changes that you can do and implement on a daily basis by making it a system of your daily routines. Thank you for watching. We meet in the next video.